This is a public health crisis that we have not seen in recent times.
Our government will do whatever it takes to keep Canadians healthy and safe.
We've been in constant communication with all the provinces and territories.
We do work very closely and collaboratively with our counterparts in the United States.
We're following the science and the evidence.
That's been some of the messaging from the federal government today on COVID-19, but the situation is obviously a fast-moving one. So how does the government manage this crisis? How is it managing it? It's Thursday. I'm here with At Issue. Chantal Hébert is in Montreal, Andrew Coyne is in Toronto, and Paul Wells is with us tonight in Ottawa. Good to see everybody. So I'm not going to get you to weigh in on public health issues because I understand many people think they are experts, but we are not any of them. So just from the perspective of how the government is managing yet another crisis. This one, a pandemic that is personally affecting them, given that they are self-isolating today. I guess in terms of tone and leadership and the kinds of things that a government needs to do in a moment like this. Chantal, do you want to start?
Well, I guess the first thing is that there is no roadmap for this, but there is no sense in thinking that it's going to be a small thing. There is previous experience now in Italy and China and what's happening in France and Spain. It all sends the same signals. I was listening to Question Period today, and the answers from the government were vague, but the subtext seemed to be that the government expects and is waiting for the other shoe to drop.
Andrew?
It's been an uncertain response, but forgivably so, because this is an extremely difficult thing to get one's arms around. When you're dealing with exponential growth, potentially exponential growth in caseloads such as we've seen, I think they've been a little bit behind the curve, shall we say, but it's dawning on them as it's dawning on the rest of the public how serious this is and how serious it potentially could be. What they're certainly hearing from a lot of public health experts is better to err on the side of overdoing things rather than underdoing things. We'll see whether that's in fact the policy that comes out, because of course there are enormous economic consequences to some of the more extreme measures that we've seen. But when you're talking about the health of the citizenry, obviously that comes first. And on top of that, the only way we're finally going to get the economy back on track out of this is when we get control of the pandemic itself.
Paul, what do you make of their approach so far, their tone so far?
I think the Trudeau government has benefited from having had good players in place already, almost by accident. Yeah. Teresa Tam, the head of the Public Health Agency, was appointed by Jane Philpott, mostly to look after the opioid crisis, which continues. Patty Hajdu, the health minister, turns out to be one of the most poised and confident and reassuring presences in this government. And it should be said that the federal government is not in charge of any kind of response to a crisis on this scale. Provincial governments, city halls, public health agencies right across the country, and ordinary Canadians who traditionally have been very good at following smart advice in good faith. And I think all of that has led to the early stages of this crisis not being as bad as it could be. I make no predictions for next week.
Yeah, I mean, the thing that has struck me is the way, one person said to me, the sort of deference to science that you're seeing as opposed to what is happening in the United States, for instance. And I'm not saying that is, the answer and this means that we'll be totally fine, but it is a marked difference in terms of what could have been a more political response. Chantal?
Yes, but deference to science is well indicated in this case.
Yes.
Justin Trudeau is about as knowledgeable of public health issues in the sense that is needed as we all are tonight. So if we didn't have science and medical experts to rely on, but also the experience of the countries who have been going through this on a larger scale for a bit longer than we have, what would you like to rely on? I don't think we should ever measure the quality of our government's response by the standards of what is happening in the U.S.
I knew you were going to say that to me, yes.
Well, because,
you're right,
because if we do that, we're not setting the bar low. We are setting the bar below any acceptable level.
But it's a critical asset, though, that you still have levels of trust in this country that seem to be rapidly disappearing in the United States. you know, if the experts are right in some of their grimmer projections on this, we're going to need to mobilize society on a grand scale to fight this, both in the sense of being willing to accept quite draconian restrictions imposed by government, and in the sense that Paul referred to of being willing to make alterations in our own lifestyle. To mobilize people, a society like that, they have to trust in their leaders, they have to trust in experts, they have to trust to some extent in the media. On all these scores, we do quite a bit better than the United States. I realize that's setting a low bar, but I just want to emphasize that without that, you're in really a terrible situation, and I very much fear what's going to happen in the United States precisely because of that. That's
a good point. Let me turn a little bit to the economic uncertainty that the coronavirus creates by the shutdown of the tourism industry and all sorts of things, the drop in the price of oil, and a government that is still planning to table a budget on March 30th. Here's a little bit of Bill Morneaus and what he said tonight.
This economic volatility is real. So I've actually gone ahead and asked the private sector economists who help us to form the basis of our economic forecasts, come back with a refresh of their expectations.
So the government so far has put forward a $1 billion package, but it was very much health-oriented, research-oriented. They say there is more there and more coming potentially in terms of the economy. Paul, that I think we can credibly talk about in terms of what the government should be doing or what more the government should be doing there.
Well, it's tricky. I mean, 10, 15 years ago, in the middle of some comparable crisis, you could expect the central bank to cut interest rates markedly, and you could expect a federal government to spend large numbers of billions of dollars through tax cuts or checks to people or spending programs. Unfortunately, interest rates have lately been close to rock bottom, and this government was already spending very close to the ability of the economy to handle it without the debt increasing in relation to the GDP. And so that doesn't leave it a lot of room to maneuver. I assume they're just going to blow out that debt to GDP ratio, as they have frankly been itching to do for a long time anyway. But they don't have the kind of latitude that John Chrétien would have had in 2001 or that Stephen Harper had in 2008.
Chantal, go ahead.
But this is, it may be just me, but I see the upcoming federal budget as a Band-Aid on a huge wound. And that's because until this crisis is resolved, I don't think any federal budget or provincial budget is going to do more than try to fill the gaps and get people over the other side of the crisis. This is also far beyond the control of any national government. When markets are crashing the way they're crashing, the oil prices going the way they're going, no single national government will suddenly wake up at the end of March and say, here's the recipe to get out of this trouble. We've seen a number of budgets over the past few weeks that have been outdated with 2 days after they were presented. The Alberta budget, the Quebec budget this week in surplus. Now the government in Quebec is saying we may be running into a deficit. So the budget is going to allocate money, but I think it's going to be crisis management money.
Okay, Andrew, you go ahead.
I'm skeptical of the value of fiscal stimulus at the best of times. I'm particularly skeptical of its usage in fighting a pandemic. We are going to go into deficit, deeper into deficit, just because of the nature of the situation we're in. But that's just, you know, there's going to be costs to be associated with probable recession and in terms of fighting the pandemic. What I think is really essential is that the government do everything to signal that the economy comes first, that it is their first priority beyond the pandemic, that they are going to do everything to reassure and provide confidence to investors and to business, because it is going to be extremely fragile going forward. And the last thing that anybody needs, I think, is for the government to indicate that they've got higher priorities than that. So I think everything else has to go by the boards for the time being.
And do we see evidence that is happening already, Paul, Chantal? Paul?
No, we don't. I mean,
the Prime Minister. Nor should we.
Only yesterday, the Prime Minister and Bill Morneaus and several other ministers had a news conference. It seems an age ago, and Bill Morneaus was not offering a lot of, frankly, interesting information about what his plans are. We really are going to have to wait for the budget if he gets to implement it. I mean, what else is going to be cancelled?
Yeah, Chantal.
I'm not even convinced that Parliament will be sitting by the end of March, the way things are going. And I certainly don't expect the government to be sending really strong signals about its way forward until the dust settles on the pandemic.
Okay, so let's just keep talking about the budget a little bit and the government's ongoing refrain saying it has the fiscal capacity to go a little further. I think the PBO said $40 billion or something. I don't know. I don't know if that's accurate, and I don't know if that's what they're talking about when they say fiscal capacity. Andrew, do you buy that notion that there's still room to be further in debt given the way things are going?
Sure. I mean, they've got a debt to GDP ratio of 30%. I'd like it to be lower, but it's not going to be the end of the world if it goes higher, especially in the middle of a crisis like this where you're going to have particular costs that are going to go with it. You're going to see probably a market slowing in economic activity. You are going to get further into deficit. As I would emphasize, I'm not sure that there's need for fiscal stimulus beyond that when you're dealing with essentially a supply problem rather than a demand problem, when basically you're shutting in a lot of production because people are staying home.
Yeah.
But this is not a time to be overly concerned with the debt to GDP ratio. What I am very worried about is some of the more delicate fiscal situations in the provinces, places like Newfoundland, New Brunswick, which are in deep trouble anyway, and this is only going to accentuate.
And Alberta, of course. But yes, your column on Newfoundland made a good point too, Chantal.
I would worry more about Newfoundland than I would about Alberta.
Sure.
Yeah.
Frankly, given there's real difference in the fiscal situation of both provinces, but for sure, no province is going to come out of this in better shape than it was going in, and provinces that are resource dependent, given what's happening at the same time to oil prices, are going to be in worse troubles than provinces that will actually benefit from lower oil prices. So I don't think the federal government is going to be the most hit by this, but it's going to have to look out for, and I'd put Newfoundland at the top of the list.
And Paul, would you, unlike Andrew, think that stimulus would be something this government would consider or would be on the table or would be needed?
They've basically been running stimulus program for the last 5 years. So I mean, when all you've got is a hammer.
Yeah.
I do think that one of the lessons we're learning from this astonishing moment in our history is how important it is to look after the fundamentals when times look good. You need to have a functioning bureaucracy. You need to have agency officials who are there because they're competent, not because they're cronies. You need to have your books in relatively good order so that you've got a little shimmy in case things get weird. And various governments have performed to various levels on all of those axes, but this is a pretty stern rebuke to those of us who think government, when it's easy, doesn't need careful work even then, because times like this come along.
It also means you need serious people in places of leadership in all the political parties. We cannot afford the kind of amateurs and freelancing that we've seen in the recent past. Things are about to get real.
Okay, good place to leave it. Thank you all, appreciate it.